Thank you for your attention. This is Jie Li from the Nanjing Drum Tower Hospital. And thanks to the invitation from the Neurosurgery Publication Office, on behalf of our team here, I am very pleased to introduce our study on the Sagittal Imbalance in Degenerative Kyphosis, Prevalence and Implication on Postoperative Mechanical Failure. Reportedly, sagittal imbalance in degenerative kyphosis occurs in different patterns. For example, the loss of lumbar lordosis and sacral slope varies in each case, and the kyphosis at lumbar or thoracolumbar region has different types of sagittal imbalance. Given the current understanding on how different patterns of sagittal imbalance occurs is limited, here we try to propose a new classification to describe the global imbalance in lumbar or thoracolumbar degenerative kyphosis and determine its implication for the risk of postoperative mechanical failure. So this is the retrospective study on 137 consecutive patients with DK. First, we classify the patients as L group if the kyphotic apex was lower than L2, and the TL group if the kyphotic apex was above L1. And then we classify the patients further through the loss of sacral slope and the presence of global imbalance. So based on this criteria, we generated an 8 subtype classification allegories as shown in the figure. So this is the demonstrative cases of 8 subtypes of patients in each groups, and the distribution of the number of the cases in each subtype. And interestingly, we found that the patient in L group has higher regional kyphosis, lower lumbar lordosis, and higher SVA than that in TL group. And we found that the SRS-22 function and pain scores were also lower in L group compared to that in TL group. And then we looked at the surgical outcomes and the risk of mechanical failure in each subtypes. On top of all, we identified that the patients in LS0 plus has the highest risk of mechanical failure of over 60%. Then patients in LS0 minus and TLS0 plus has high risk of mechanical failure of over 40%. So here is the risk of mechanical failure distribution map, showing the highest risk of mechanical failure in LS0 plus subtype. And additionally, we identified the risk factors associated with mechanical failure. In both TL group and L group, we found that the lower BMD was associated with higher risk of mechanical failure, while in TL group, we found that the use of multi-rod fixation was associated with lower risk of mechanical complication. And in L group, we found the use of 3-column osteotomy and the pelvic fixation was associated with lower risk. So, in conclusion, the present study deciphers the distinct patterns of global imbalance in patients with severe thoracolumbar or lumbar degenerative kyphosis. Patients in LS0 plus, LS0 minus, and TLS0 plus has significantly higher complication rates of over 40%. These novel stratification allegories will aid clinical decision-making in identifying the risk for mechanical failure in patients with severe decay, thereby allowing for individual preventative measures to achieve satisfactory surgical outcomes. Thank you very much.